Hey there, health enthusiasts and curious minds. Have you ever heard of a condition where your body's defense system goes a bit haywire? Imagine your immune system, usually your loyal protector, suddenly turning against you. That's what happens in paraneoplastic syndromes, and today we're diving deep into this fascinating topic. In this video, we'll explore the causes, detection, and prevention of these rare but important conditions. So, grab a cup of tea, get comfortable, and let's unravel the mystery of paraneoplastic syndromes together. First things first, what exactly are paraneoplastic syndromes? Simply put, they're a group of disorders that occur when your immune system, while trying to fight cancer, accidentally attacks healthy cells in your body. These syndromes can affect various parts of your body, from your nervous system to your skin. The tricky part? They often show up before cancer is even diagnosed. Now let's talk about what causes these syndromes. It all starts with cancer cells in your body. Your immune system spots these cells and says, "Hey, you don't belong here." It then creates antibodies to fight these cancer cells. But sometimes, these antibodies get a bit confused. They start attacking healthy cells that look similar to the cancer cells. It's like your immune system is wearing blurry glasses and can't tell friend from foe. Different types of cancer can trigger paraneoplastic syndromes. Lung cancer is the most common culprit, especially a type called small cell lung cancer. Breast cancer and ovarian cancer are also known troublemakers. Even cancers of the lymphatic system, called lymphomas, can sometimes set off these syndromes. Now let's break down the types of paraneoplastic syndromes. First up, we have neurological syndromes. These affect your nervous system and can cause all sorts of issues. Imagine suddenly having trouble with your balance or your muscles becoming weak for no apparent reason. These could be signs of a neurological paraneoplastic syndrome. Then there are endocrine syndromes. These mess with your hormone levels. You might suddenly gain weight, feel extremely thirsty, or notice dark patches on your skin. These could all be signs that your hormones are out of whack due to a paraneoplastic syndrome. We also have dermatological syndromes. These affect your skin and muscles. You might develop a rash or notice your skin becoming thicker in certain areas. These changes could be your body's way of saying, "Hey, something's not right here." Lastly, there are hematological syndromes. These affect your blood and bone marrow. You might feel constantly tired or notice you're bruising easily. These could be signs that a paraneoplastic syndrome is affecting your blood cells. Now, detecting these syndromes early is super important, but it's not always easy. The symptoms can be vague and might not seem related to cancer at first. That's why doctors need to be on their toes. If you suddenly develop unexplained neurological symptoms or hormone imbalances, your doctor might consider testing for paraneoplastic syndromes. They might order blood tests looking for specific antibodies associated with these syndromes. They might also recommend imaging tests like CT scans or PET scans to look for hidden cancers. Dr. Emily Carter, a neurologist who specializes in these disorders, says,
"A key step in managing PNS is to recognize the clinical pattern early. In cases where we see unexplained neurological decline or rapidly progressive weakness, we must think of a paraneoplastic process. Our role is to connect the dots between the symptoms and a potential malignancy, even when it's not yet clinically apparent."
It's like being a detective, piecing together clues to solve a medical mystery. Now you might be wondering, can we prevent these syndromes? Well, it's not easy, but there are things we can do to lower the risk. Regular cancer screenings are super important, especially if you're at high risk for certain cancers. For example, if you're a heavy smoker, getting regular lung cancer screenings could help catch cancer early, before it triggers a paraneoplastic syndrome. Some researchers are also looking into ways to control the immune system in high-risk patients. The idea is to prevent the immune system from overreacting and causing these syndromes. This research is still in its early stages, but it's an exciting area to watch. If you do develop a paraneoplastic syndrome, don't worry. There are ways to manage it. The main goal is to treat the underlying cancer. Often, when the cancer is controlled, the symptoms of the syndrome improve too. Doctors also use medications to calm down the overactive immune system. These might include steroids or other drugs that suppress the immune response. Physical therapy and other supportive treatments can help manage specific symptoms. Dr. James Reynolds, another expert in this field, emphasizes the importance of a team approach. He says,
For many patients, controlling the immune system's overactivity is crucial.
We often use immune-suppressing therapies like corticosteroids, IV immunoglobulin, or plasmapheresis to calm down the immune response. This can provide relief while cancer treatment is underway. An oncologist might work with a neurologist, an endocrinologist, and other experts to provide the best care. It's also important for patients to be aware of potential symptoms. If you're undergoing cancer treatment or are at high risk for cancer, knowing about paraneoplastic syndromes can help you catch them early. And there you have it, folks. We've journeyed through the complex world of paraneoplastic syndromes. Remember, while these conditions can be scary, early detection and proper management can make a big difference. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information. Do you have any experiences or questions about paraneoplastic syndromes? Drop them in the comments below, and don't forget to subscribe for more health insights. Until next time, stay curious and stay healthy.